Hi viewers, in today's video let us discuss about infertility. Today I will tell you the major causes that is contributing for infertility. I think by the end of this video you will be able to identify your own cause of infertility and can even specify your gynecologist in helping to identify the cause. Infertility can be defined as a woman of reproductive age has not conceived after 1 year of unprotected vaginal sexual intercourse in the absence of any known cause. There are two types of infertility. One is the primary infertility and the second is secondary infertility. Primary infertility is when the woman has not become pregnant in any time till now. Secondary infertility is when the woman has previously been pregnant regardless to the outcome of the pregnancy and now is unable to conceive. In the sense, regardless of the outcome can be an abortion, a preterm delivery, an IUGR or a normal baby. Now, let us discuss the general causes first, which is contributing to the delay in pregnancy. The frequency and the timing of intercourse plays a major role in infertility. 2 to 3 days in a week of physical contact increases the chances of pregnancy. When there is one time physical contact per week, the probability of pregnancy is 17%, whereas if the contact is 3 times, the percentage is 50. Physical contact plays a major role as the sperm can stay alive for nearly 4 to 5 days, whereas an ovum can stay alive only for 1 day, that is for 24 hours. Now, let us discuss the causes related to women. In female patients, the age of the patient is the age of the egg. As the woman delays her age of conception, the egg also gets aged. So, the quality of egg will be poor, leading to infertility or a baby with congenital anomalies. Researchers have shown that 11% of women were infertile by the age of 34, 33% of the women were infertile by the age of 40, and 87% were infertile by the age of 45. Obese women with a BMI more than 30 have a decreased chance of conception. Cancer and tumors can lead to infertility. A tumor directly damaging the uterus can delay the conception. Removing a cancerous organ that normally would be needed to have a child can also cause infertility. Treatments for cancer that can change the hormone levels can put a woman into early menopause, can also damage the nerves or make certain sex organs to stop working properly. Psychological and emotional responses such as stress and anxiety can also lead to infertility. Clotting disorders as thrombophilia is a common cause of recurrent miscarriages. Increased prothrombin levels can lead to miscarriage and stillbirths. Antiphospholipid antibody syndrome or Hughes syndrome is an autoimmune disorder characterized by the presence of abnormal antibodies in the blood is a major factor for infertility. Diabetes is a major problem that is contributing to infertility. Diabetes can lead to polycystic ovarian syndrome, that is a leading cause in infertility. It can also lead to oligomenorrhea or irregular periods. Sometimes there is secondary amenorrhea or absent periods, premature menopause, that is premature ovarian failure, microvascular and cardiovascular complications as a complication of diabetes. Fibroids or polyps inside the uterus can lead to infertility. Uterine fibroids are benign, non cancerous tumors that contribute to infertility. Fibroids occur when a single muscle cell in the wall of the uterus multiplies and grows to form a non cancerous tumor. Fibroids can change the shape of the uterus and sometimes the cervix also. Birth defects of the uterus can also contribute to infertility, that is, Mullerian abnormalities. Abnormal development of the uterus or the fallopian tubes can cause infertility. Agenesis, that is, absence of the vagina or the uterus, or sometimes it is both the vagina and the uterus is absent. Absence or even duplication of the uterus, cervix, and vagina can also contribute to infertility. There are also women presenting with unicornate or bicornate uterus without a fallopian tube can also develop infertility. The cancer and the chemotherapy plays a major role in infertility. The patient's age and the stage of development of cancer as after the menarche and the menopause plays a major role. The type and the extent of surgery used for cancer also contributes to infertility. The type of treatment given includes the radiation therapy, chemotherapy, hormonal therapy, targeted therapy, immunotherapy, stem cell transplants also contribute to infertility. The dose of treatment all affects the fertility rate of the women. Malnutrition, obesity, anorexia nervosa, bulimia nervosa all can contribute to infertility. An imbalanced caloric and protein intake due to incorrect food consumption is responsible for severe under or overweight, leading to alterations of the ovarian functions with subsequent increase in the infertility rate. Vigorous exercises may affect the fertility rate of the women. Exercising for a long duration can also affect their estrogen levels, leading to infertility. Drinking alcohol may cause problems with menstruation and ovulation, which can affect the fertility rate. Alcohol may temporarily inhibit the production of estrogen and increases the level of testosterone, which can interfere with normal menstruation, causing infertility. In females, alcohol consumption causes an unfavorable environment for the fetal conception. Drug abuse in females affects the endometrial layer of the uterus and also causes hormonal imbalance, which leads to infertility. Low levels of thyroid hormones can interfere with the release of an egg from your ovary during the ovulation period, which impairs the fertility. And autoimmune or pituitary disorders can also affect the fertility rate in women. Endometriosis or scarring due to the previous abortions can cause infertility. Disordered anatomy of the pelvis and adhesion of the layers, scarred fallopian tubes, inflammation of the pelvic structures, altered immune system functioning, changes in the hormonal environment of the eggs, and impaired implantation of a pregnancy and altered egg quality all can contribute to infertility. PID or pelvic inflammatory disease is a major cause in infertility. 1 in 10 women with PID becomes infertile. PID can cause scarring of the fallopian tubes. This scarring can block the tubes and prevent an egg from being fertilized. Ectopic pregnancy, that is, scarring from PID, provides an unfavorable environment for the fertilized egg to get implanted in the body of the uterus, leading to ectopic pregnancy in any other part, especially the fallopian tubes. By now, you can have an idea what is the cause of infertility in your case. Now, in the upcoming video, we can have a discussion about male infertility. Thanks for watching and subscribe for more videos.